Hi, I'm Dr. Steve Myers, and I'm here with my patient Harold, who is 3 months out from a bilateral knee stem cell procedure for knee arthritis. Before we talk to him, we're going to take a quick look at his x-rays and see what kind of issues he was dealing with. Okay, so taking a look at Harold's knees. On this side here is his right knee, and this is his more symptomatic left knee. If we zoom in on his right knee, you can see that he has pretty good joint space on the outside of the knee, but he's got a big bone spur on the outside here, and then significant loss of joint space on the inside of the knee. This loss of joint space, loss of dark space here, is loss of cartilage. We call that arthritis in the knee. Big bone spurs above and below the joint on the inside as well. Looking at the more symptomatic left knee, the joint space on the inside of the knee is completely obliterated. He's bone on the inside of the joint. Big bone spurs above and below the joint on the inside. Pretty good joint space on the outside, but significant loss, complete loss of joint space, severe arthritis on the inside of the left knee. Okay, so thinking back to before procedure, before 3 months ago, what kind of issues were you having with your knees? What kind of trouble were you having?
It was where I couldn't hardly do anything. I had so much pain. It's more so in my left knee than my right knee, but it was really bothering me. I couldn't get around, do anything because of the pain.
Okay. What kinds of activities were especially difficult?
I play golf. I couldn't play 18 holes of golf. I couldn't mow my yard. It hurt so bad to get up and walk around. I couldn't do anything hardly.
So walking was difficult, having
Yes.
trouble just getting out on the golf course.
Correct.
Okay. Why ultimately did you decide to go through stem cell for your treatment?
Well, I'm 59 and a half. I was 59 and a half when all this started, and I didn't want to go through knee replacement and take the chance on that wearing out, and then at a later age have to do knee replacement again. I come to your seminar, was impressed with what you presented. I read up about it and it sounded like a good thing to try, and I've been very, very pleased with it.
So here we are, 3 months from procedure. How are you doing?
Doing great. I have no pain in my right knee at all. Very, very, very little pain in my left knee. It's just so much greater than it was before I ever started this.
Are there activities that you're able to do now that you couldn't do before?
Yes, I'm back to playing golf. This past week I played 3 rounds of golf, 3 18-hole rounds of golf, no pain. It was amazing.
So thinking back to before procedure compared to how you're doing now, 10%, 50%, 90% better? Put a number on it.
95% better. Unbelievable how much better it is.
Having been through it here 3 months down the road, do you feel like you made the right decision with your treatment?
Absolutely, and I strongly recommend this.
Very good. Well, thank you so much for coming in and sharing your experience. I appreciate it.
Thank you, Dr. Myers. It's been enjoyable.